We're going to go ahead and get started. Thank you all for coming today. In case you don't remember the event that you signed up for, you are here for the MCAT 2015 presentation that's sponsored by the Health Professions Advisory Center, also known as HPAC, which a lot of you are really familiar, so you go to the office. And then also the Career Center that's on campus. Just really quickly before we get started, just a couple of things. First of all, before I forget, the Career Center is having a Health Professions Info Day fair on Wednesday, April 16th, I believe that is, from 3 to 6 p.m. and it's over in the hub. So if you're interested in a variety of health careers, medicine, dentistry, optometry, and most of you are interested in it, probably either medical school or podiatry school. But if you're looking at other careers, that's an option on Wednesday, April 16th. Secondly, if you're not familiar with our office, so you know a little bit about it, we have a variety of workshops and events that we host for students like yourself that are interested in professional school. So you can hop onto our website at hpac.ucr.edu and find out those events there. Okay. Before, again, I start with the introduction of our speaker, we're going to take questions at the end. So this is going to go from, let's say, a few minutes after 4 and up until 5 o'clock. We will have time for questions. When you do ask your question, you can do it from your seat. We have 2 microphones that are built into the ceiling, either in front of you or behind you. And so just when you're speaking, if you could sort of speak up so everybody can hear it. Becky will be able to hear it who's in Washington, D.C. And then we're also recording this event, and we'll put it on the HPAC website. We'll have it there probably by next week. And that way, if you want to go back and watch it, you can do so. We'll also send it out on the listserv or a link to it on the HPAC listserv. So just a little bit about our speaker. Her name is Becky Rice, and she's actually with the AAMC, which is the Association of American Medical Colleges in Washington, D.C., and she's the Director of Services Outreach there. She oversees the communication efforts for the MCAT, which we're here to find out about, as well as the MCAT, which all of you will probably use if you're applying to medical school in the next couple months or in the future. And Becky has really been a great colleague to us in terms of offering this workshop. We're here and it's 4 o'clock. It's a little bit after 7 o'clock on the East Coast where she is, so we absolutely appreciate her time for staying late. And Becky's been with the AAMC for about 15 years and is very knowledgeable, and she works with the team who recreated the test that all of you are about to take, some of you as early as 2 weeks. So we're going to go ahead and start with Becky, and then again, we'll do questions at the end.
So can everybody hear me?
Yes.
Okay, great. Well, thanks everybody. Greetings from the East Coast. It is 7 o'clock. The only thing I'm disappointed about is that I'm missing an Orioles game tonight. So that's okay. I don't mind. I can catch up on that. But thanks for having me here today. And like it was said, I do work with the MCAT team. I actually started with the MCAT team. So I've been with that team through the transition. And now I oversee a lot of the services that the AAMC offers. So we have a slide at the end a little bit about some of the others we offer, but we're going to talk today about the transition to the new MCAT exam, which is less than 2 weeks away. So today we'll talk about the new exam, kind of the makeup of it. We'll talk about the score reports because they are going to be different for the exam. We'll talk a little bit about the testing year because there are some changes to our policies and procedures, and just to kind of go over the year in general. I want to talk about testing early for those of you who might be in an April or a May date, even a June date, because that's early this year. Again, go over those testing policies. Like I mentioned, a few of them have changed, and then go over some of the resources we have to help you prepare for the exam, and just close it out with a Q&A for anything maybe that I haven't answered for you. So just to take you back a step in time, the last time the MCAT exam was completely overhauled was 1991, 25 years ago. That was actually the year they started mapping the Human Genome Project, to give you kind of a frame of reference. And our CEO and president, Daryl Kirsch, wanted us to look at the MCAT exam and basically start to prepare an exam that was really going to prepare tomorrow's doctors for what they were seeing in the healthcare arena. We kept the things that worked about the old exam, and we've added some new things that we think will really help us identify those folks who have both the content knowledge and the skills necessary to become physicians moving forward. So what's different about the exam? And I don't know if you can see, there's actually a blue circle on the screen and then there's a gray circle. Some people have a little bit of difficulty seeing the gray circle. But just in general, it's going to require broader preparation in terms of content, and it's going to test more reasoning skills. So the content that's on the old and the new exam includes biology, chemistry, physics, and those reasoning skills. There was an old verbal reasoning section on the old test, and so there'll be similar reasoning skills. But the new content on the new exam includes psychology, sociology, and biochemistry. And as I mentioned, you're going to be asked to do a little more scientific reasoning, and we're going to focus a lot on health disparities and population health, just a broader range of topics. So what it's designed to accomplish. So this test is designed to test the concepts that medical school faculty, residents, and medical students rated as key to an entering medical student's success in today's environment. And it's also going to emphasize the educational outcomes by asking you to apply not just what you know to answer a question on your knowledge, but to apply it, to use charts, graphs, and things like that, and your reasoning skills. So that's what's it's going to be designed to accomplish. Also, we're going to increase the emphasis on the scientific and critical reasoning skills. We want you to think like scientists, bring together the concepts from the natural and the social sciences, and reason about research design and results. You're going to be asked to interpret data and draw conclusions. So finally, it's going to underscore the role that behavioral and social cultural factors play in health and illness. People have asked me, is the new psych and soc just to determine whether or not I'm going to have a good bedside manner? And the answer to that is no. Again, it's about the role that behavioral and social cultural factors play in health and illness. And it's organized around competencies and expert panel reports that are noted here on the slide. So these are the competencies that were important for entering medical students to know and to be successful in medical school. So the new exam itself, and if at any point you want to take out your iPhone or your pad or whatever and take a picture, I don't mind if you want to take a picture of the screen. So the new exam has 4 sections. There are 2 natural sciences, biological and biochemical foundations of living systems, and the chemical and physical foundations of biological systems. Then there's the new section, which is the social and behavioral section, psychological, social, and biological foundations of behavior. And then there's the critical analysis and reasoning skills, which is similar to the verbal reasoning from the old exam. And I want to point out the URL that's on the screen. This is our online blueprint to the new exam, and I'll show it a little bit later in the presentation, but this is the place to go for all of the content and concepts you will be responsible for knowing. So let's break it down a little bit more. In the 2 natural sciences sections, there are big concepts, the big ideas, and there are 3 of them in the biological and biochemical foundation section, and there are 2 in the chemical and physical. And again, these are the big ideas, the big topics. And underneath these are what we call the content categories. So the content, the topics, and the subtopics that fall under these big ideas that you'll be responsible for knowing. For the psych and soc section of the exam, there are 5 of these competencies. Just know that it doesn't mean that because there are 5 in this one section, there's a lot more of them. The topic and subtopic lists are a little bit shorter under these competencies, so it equals out. Trust me, it's not that it's overweighted on this new psych and soc section. So again, these are the big ideas, the big concepts. And if you visit that tool, it'll go into it in more detail with videos describing each of these foundational concepts. So people say, well, where am I going to learn about this? Well, our research has indicated that at many colleges that the concepts and the content are taught in introductory biology, general and organic chemistry, and physics, and also the concepts from first semester biochemistry courses, as well as first semester psych and soc. And there are research methods and statistics concepts that you'll need to be familiar with on the new exam, but you don't need to take a separate statistics course. Actually, you'll see a lot of these basic concepts in introductory science labs, as well as introductory psych or soc. So one thing that is unique about the new exam is we're not asking you only to know about the content, but to apply inquiry and reasoning skills to the content. So there are 4 skills, and each question is going to have one of these skills attached to it, if you will. So a lot of what you're going to see involves charts and graphs and tables, and you're going to be asked to take a look at that and then answer the question using what you see and interpreting that data. And as you can see, these are the 4 skills. So each question will have one of these 4 skills kind of attached to it. So it's no longer about rote memorization or, just kind of repeating the information you know. You're going to have to do some reasoning along with it. So people have asked me what research methods and statistical reasoning skills will you need to know, and these are the concepts. We have them listed on that online tool that I've mentioned, but just so people can see, these are the concepts that you will need to be familiar with when it comes to answering the questions, and again, looking at the tables, the graphs, the charts, and coming to a conclusion or giving your answer. So for the critical analysis and reasoning skills section, this is similar to reading tests students have taken. It is approximately 500 to 600 word passage that you'll read through, and then there'll be questions associated with it. So you're going to be asked to analyze, evaluate, and apply the information. One thing that is different about the new exam is that it used to be that the verbal reasoning section had scientific and technical topics that you read about, and we're not going to have those as anymore. What we are focusing on are the humanities and the arts. So it might be ethics, it might be diversity of cultures, it might be socioeconomic differences. So those are the kind of passages that you'll be reading about. You don't need to have any specific disciplinary knowledge about the topic. Everything you need to know to answer the question will be in the passage or in the question that you're reading, asking you to think about and come to a conclusion based on what you've read or what the question is asking you. So you don't need separate courses for this. You don't have to run out to take an ethics course or anything like that. But those are the topics that you're going to see. So the humanities and the arts. So that's a big change on this section, is it's less scientific and technology related in terms of the passages that you'll be reading. The score reports. I went to a recruitment fair yesterday, and somebody came up to me and said, is 510 the new 30? And I know that I've seen that out in the marketplace. And what I can tell you is we haven't even had the first exam yet, so we don't know what the new anything is. And a couple of things. The exams are very different, and that's one reason why there's a very different score scale. And we won't know what the new percentile rankings are and things like that until the first folks take the new exam. So with that said, the new exam is going to be graded similarly to the old exam. Each section will have a score, and those will add up to give you your total score. So each section will have a range of 118 to 132, and that will total up to 472 to 528. So that's the range. A couple of notes about this graph. It's a kind of a curve, obviously, but the MCAT exam is not graded on a curve. I just want to make that very clear. The reason we did this is to show that obviously you're going to have some people on the lower end of the scale and some people on the high end, but you're going to have more folks in the middle. And this was to help the admissions committees understand that you're going to have outliers on either side, but the majority of folks are going to be in the middle there. And we wanted them not to overemphasize the high end of the scale, as they sometimes have done. So again, the middle is going to be about 500. So just wanted to point out the numbers. Couple of reasons why we picked you might say, why are these such strange numbers? One, we didn't want it to overlap with the current exam, so there was no confusion. Number two, they didn't want someone to say, confuse it with a percentage. So they took it out of the 0 to 100 range. And then lastly, they didn't want it to overlap with any other existing standardized test which has a numeric grade scale. So that's how we came up with this system. If you'll notice, the point scale for section is a 15-point range, which is similar to the old score scale, where the scores range from a 3 as a low to a 45 to a high. There's also something that's going to be new and different with the score report. This is what the new score report is going to look like. So this is a mock-up of what you're going to see. The difference is we used to provide the medical school admissions with your percentile rank and your score, but you saw your score. Now, what you see is what admissions folks are going to see. So everyone will see the same information. So what you'll get is your section. You'll have a numeric score for that section. And then the next thing will be the confidence band, and that is the margin of error that there might be in the score. Or in other words, if you were to retake the exam without any additional preparation, this is the likely range that your score would fall in. And it's going to be a 2-point scale. That's going to be the difference. And what we're hoping with the confidence bands is we'll show that the admissions officers won't emphasize small differences in scores. So that's what the confidence band indicates. Your percentile rank. The first one shows 50%. That means that you scored at or better than 50% of the people who took this test. So about middle of the pack. For this report, you can see that the person's strongest was the biological and biochemical, and their weakest section was the psych and soc. And at the end, it'll show you a score profile showing your strengths and weaknesses on the various sections of the test. And for those people who might not be comfortable with their score, this is probably a good indicator of where you might need to focus efforts if you're interested in restudying for the exam. So again, this is what you will see, and this is what the admissions community will see. You'll both see the exact same thing. The admissions folks have always been getting those percentile ranks, but over time, the numeric score gained meaning, so they haven't been using them as much. So a couple of things about it. There are more questions per section on the exam, but you are going to have more time to answer questions. So it's going to give you a more reliable score. Again, it provides information about how your score stacks up compared to those other applicants who took the same version of the test. And we want to guard against admissions officers overweighing the small score differences. That's that confidence band. Again, it'll highlight your strengths and weaknesses, and if you're interested in taking the exam again, it'll show you where you need to kind of focus your effort. And we wanted to emphasize the center of the score scales with round numbers like 500 and 125, because what our research shows is people who score in the middle of the score scale range, they typically do well in medical school. They graduate in 4 to 5 years. They're less likely to drop out due to academic reasons, and they typically pass their STEP exams on the first try. So moving on to the testing year. So it's starting in less than 2 weeks, and I just have to tell you, it's a little bit crazy around here at our office. We start next Friday and Saturday with administrations. This is the testing year for 2015. The dates for April, May, and June, you can register for dates now. We know that May is pretty much filled up, June pretty much filled up. There are still some dates for April, but we've passed seats for April. We've passed the registration deadline for that, and we'll open registration for July, August, and September the week of April the 20th. So I believe it's the 21st and the 23rd. We'll open on the 21st for the July and August dates, and we'll open on the 23rd for the September dates. There are actually 15 dates on the calendar. We added a date in September on the 22nd. So this is a revised calendar. And you can see there on the right-hand side, the administration date and your score release date. And I'll talk a little bit about score release dates in a moment, because there will be a delay for the first exams. So here's what your test day is going to look like. These are the order in which that you will see the sections as they appear on the exam, the number of questions and the amount of time that you will have. So the total content time for the exam is 6 hours and 15 minutes, but the total seat time is 7 hours and 30 minutes. And that includes things like the examinee agreement and watching the tutorial if you want to do it. There are also breaks in the day, two 10-minute breaks and a 30-minute mid-exam breaks. Those are optional if you would like to take them. You don't have to take them. So a couple of important comments about test day and logistics. You will definitely need the proper ID. I would suggest that when you register for the MCAT exam, have out the ID that you will present on that day when you register to take the exam. And please make sure that that ID will not expire before you plan to take the exam. For those who require accommodations for taking the exam, we do offer that and you can request them. I would suggest you do that as soon as possible because it does take up to 60 days to review the application and determine whether or not you'll be provided with accommodations. Examinees who do receive accommodations will, with extended time, they will be allowed to test over 2 days. As you can see on our schedule, there are a lot of Friday, Saturday dates, so they're back to back, and that certainly was on purpose to let those with accommodated testing test over 2 days. Again, a 30-minute mid-exam break and 2 10-minute breaks. I want to emphasize this. 30 minutes seems like a long time, and you can certainly eat, but you must bring your meal with you. You cannot leave the building during test day. You have to stay within the building. I can't emphasize that enough. If you need soda, if you need coffee, if you need a snack, bring it with you because you will not be allowed to leave the building. For those who may need to travel, we do offer a discount through Hampton Inn with a special rate code. I believe the deal is you get 5% off their best internet rate. Again, so if you'd like to take advantage of that, you don't have to be testing for the MCAT exam. You can actually take advantage of that. So just want to let you know. So the fees for the new exam. So the fee is $300. This is a $25 increase over the old exam, and it's to account for the longer testing day and more questions. For those students who apply for and receive fee assistance program benefits, the cost will be $115. And I'll talk about the fee assistance program in a minute, some more details about that. The fee is due and payable at the time of registration. You can only register for the MCAT online, and we take Visa or MasterCard only. And if you have a debit card, it must have the Visa or MasterCard logo on it. So there's no sending a check later, no bill me option. You have to pay at the time that you register. So a couple of words about testing early, because there are going to be some unique things that happen in April, May, and June with the new exam. So you might say, why would I test in April? Well, if you are interested in submitting your application this year, your test results from the new MCAT exam will be part of the first batch of verified applications that are pushed out to medical schools. However, it is going to take us a little bit longer than normal to do the test scoring for the first couple of exams. So what we plan to do is send preliminary percentile rank range reports, or make them available to examinees who test in April, May, and June. And you'll get these about 3 weeks after you sit for the exam. And what it'll show you is a range, your percentile rank range. This is our estimate of where we think your scores are going to fall. So let's say that your range is 70 to 80%. That means that you scored at or better than 70 to 80% of the individuals who took the exam. And that might make you feel really good and really comfortable. Conversely, if you scored in the 20 to 30 percentile rank range, that means that you only scored better than 20 to 30% of the people who took the exam. And that might impact, maybe where you want to apply, or if you decide you want to retest. So it gives you a little bit more time to decide if you want to retest if necessary. For those who test in April, they will receive a $150 Amazon gift card. I just want to point out, if you signed up for an April date, you'll get that card if you take the test and have it scored. And even if you take the test and decide at the end, no, don't score it, I want to avoid it, because you can do that at the end of the exam, you'll still get your gift card because you completed the test. You will not get your gift card if you're a no-show, or if you decide when you get there, no, I'm not going to take it. So just want to let you know that those are kind of some of the parameters around the gift card. And for those who get the fee assistance program, they'll receive a $60 Amazon gift card. May will take a little bit longer than normal too, not as long as April, but they'll also get the preliminary percentile rank range report. And June, we're going to send it out to the June examinees. By June, we'll be back to our normal 30 to 35 day reporting cycle, but we still thought it would be nice if we gave those folks in June kind of a heads up as to where their score rank might be. So again, just to go over the benefits of testing in April and May, you'll get the Amazon gift card in April, May, and June. You'll get your preliminary percentile rank range about 3 weeks after you test. And for those that test in April and May, medical schools will get your scores at the same time as examinees who may have taken the old exam. So for those who have rolling admissions, meaning that as they get verified applications, they start reviewing them, they won't put yours in a pile because it's waiting for its MCAT score. Your MCAT score will be submitted. So in early May, the AAMC system will open up to begin applications. You can hit submit on early June, and then we'll begin verifying. All verified applications will go out in early July to the medical schools. We're holding back a little bit longer than we normally do to make sure that those April and May test scores can be part of applications that have been verified. And the verification queue is a rolling queue. So when you hit submit for your application, you then go into the queue to be verified. So the sooner you are able to complete your application, the better. But I will say, take your time on the application. It's not a weekend thing. You're going to have a lot of information that you need to include in it. And most people enter up to 52 individual courses from at least 2 undergrad institutions. That's kind of the average. And just that alone will take time. Plus, you'll need to get your transcripts. You'll need your letters of evaluation. You need to write your essay. A lot of it goes into it. So you definitely want to take your time and make sure your application is complete and as polished as you want it to be. So here's kind of the score release dates. As we mentioned, for April, so this first group of test takers, this is where we're going to be setting the SOAR scale. And you might say, well, how do you know what an entire year is going to look like? Well, we have lots of data that shows us the idiosyncrasies and the changes that happen throughout the testing year. So we know what an April test taker looks like versus the summer versus later into early fall. So we have a lot of calibration, a lot of work to do on that. And there are people with highly advanced mathematical and statistic degrees who will be working on this. So in order to set that score scale that will be valid across the year and across all testing years, it's going to take a little extra time. And that's why it's going to take us about 60 days to report April scores, about 45 days to report the May scores, and then by June we'll be back to the normal schedule. So that's why we decided to offer the preliminary percentile rank ranges. So test day policies, a couple of things that are new. I can't recommend enough you going to our website and just taking a look at the essentials document we have. This is a PDF that you can review. It includes everything you need to know about registration, rescheduling, cancellation, test day, kind of some tips for what to do on test day. So it's kind of required reading. You definitely want to take a look at this. It tells you what to do if you feel like you've had a problem on test day, you know, what the steps are for, you know, contacting us about that. So I would highly suggest that you read the essentials. It's just really important for you to know everything you need to know about test day. So one of the changes this year is that we are going to have testing limits for the new exam. And so I just want to say, if you took the previous exam, your slate is wiped clean when it comes to this. This is only going to start counting with the new exam. So you can test up to 4 times over 2 consecutive years. And in 1 year, you can test up to 3 times. And then in a lifetime, you can take 7 MCAT tests. We think that 7 is enough to get you where you need to be. And, you know, there certainly can, you know, ask us if you need additional time if you think, but we feel like 7 should be plenty of time and plenty of attempts to get what you need. I just want to make sure you know voids at the end or a no-show count as an attempt toward taking the exam. So think about it very seriously before you register, really, and make sure that you feel confident and comfortable with the time frame you've selected to take the exam. So testing accommodations. Examinees with extended time will be allowed to test over 2 days, so that's new this year. Accommodated testers are no longer annotated, and we've updated the website for easier navigation. This is an online system where you go in and submit your application and any documentation. It's secure and it's efficient, and it also now stores all of the decision letters for easy access in the future, and you can kind of track where you are in the system. If you have any questions about accommodations and what you might need to do. There's a lot of information on our website, but you can also email us at the address you see on the screen here. So the fee assistance program, I did mention this. This is something that the AAMC funds itself, and it's so to offer assistance to those who might not otherwise be able to take the exam or actually apply to medical school, because there are fees associated with that. So some significant changes for 2015 is the approval, once you receive it, is valid for 2 calendar years. So you don't have to reapply every year. Financial information is required for all living parents, and students with DACA status are now eligible to receive fee assistance, deferred action for childhood arrivals. So I would also recommend the fee assistance program is not retroactive. So you can go there now and apply to see if you qualify and if you'll receive benefits. But if you were to register for the MCAT exam and then apply for fee assistance and be granted the award, you wouldn't get any money back. It's not retroactive. So you can go online today at the address or the website you see on the screen and just go ahead and apply if you think that you have a need or that you might qualify for financial assistance. Here's what you get. So it's a reduced MCAT fee. So it's $115 instead of $300. You do get a stipend toward an updated evaluation if we require that for evaluations. If your diagnosis is too many years old or something like that. And we do offer free MCAT prep products, and I'll go over what all those are. In addition, if you receive the fee assistance program, you get free access to the MSAR, the Medical School Admission Requirements online subscription. And you also, when you get ready to apply to medical school, you have your initial fee waived, which is $165, I want to say. And then each additional medical school that you apply to is, I want to say, $36. And most people apply to an average of 15 schools. So we waive that initial fee as well as those 14 additional schools. So those are the benefits that you receive through the fee assistance program. So let's get into the prep products to help you prepare. So as a nonprofit organization, our goal is to make low cost and free products available. So that is what we have been working on. I'm going to start out with kind of the free products we have available and the free resources, and then I'll get into some of our low cost products. You can find all the information about any of the products at the website URL you see on the screen. So I had talked about that interactive tool, the online blueprint. This is it. This is our interactive tool. It's called What's on the MCAT 2015 exam. And basically, this is everything you need to know. We used to post for the old exam the content outlines in PDF format, which was kind of like a long study list. You can still do that through this tool. However, what we've done is we've broken it out into chunks and sections, and we have videos explaining each section. We also have sample questions that include those the scientific inquiry and reasoning skills and how they're kind of wrapped into the questions. And the videos will explain why the correct answer is correct and why the incorrect answers are not correct. And it will also tell you what skill the question is asking you to demonstrate. So if you go to the site, you'll see the 4 sections of the exam, and you can click on Learn More to get into any. So I picked the Psych and Soc, that's the newest one. So when you go to that, you'll see the foundational concepts that are related to that section, the big picture, the big ideas. This is also where, if you want to, you can print out a PDF of that section's content, and that's going to be your study guide, your list, your content list of everything in that section, if that's your preferred method. But if you were to click on the Explore of any of these foundational concepts, what would happen is the page would open up and you'd see a brief description. On the left-hand side, I wasn't able to get the whole page on the screen, so this is kind of a breakup of the page into 2 parts. So you'll see the basic description, and then there's an overview video that talks you through it. And then further down is the topic level key that tells you where these topics are pulled from, like introductory psych or soc. And then it'll go into the detailed list of the topics and subtopics you need to know in this section. And then there'll be an example question video, again, showing you how those skills are wrapped into the question. presentation. So each page has this. Each content category has the detail, the drill down, so you'll be able to get to what you need to get to. On the left-hand side where the red arrow is, you can navigate to whatever part of this outline you want. You don't have to go in linear fashion. You don't have to do the whole thing, but you can go to any part of it at any time. It includes all the 4 sections. There's also detail about all the scientific inquiry and reasoning skills, and there's also the critical analysis and reasoning skills. We also have the periodic table of elements that you will see on the exam in this tool as well that you can click on. I don't know how many of you are familiar with Khan Academy or maybe have used their videos, but in 2012, Saul Khan came and spoke at our annual meeting about his education style. And someone at the end of his talk went up to him and said, hey, we've got this new MCAT exam. You guys ought to do videos for that. And the Khan Academy collaboration was born. So what these are is these are collections of videos, instructional video tutorials that go through the content of the new exam. We started with the Psych and Soc because that was the newest. And we posted the first group of videos on the site in 2013, and they've been adding to the collection ever since. It'll be complete this spring. It includes all the natural and social science content on the exam, and right now there are over 900 videos and 2,000 review questions that you can look at on the site, and you can get to it directly. If you go to khanacademy.org and type in the search MCAT, it'll pull it up too, but this is the direct link that gets you right to the opening page where all of the information is. We also have on our website our Psych and Soc textbook resource. And basically what we did is, since this was a new section, we reached out to introductory textbook publishers of Psych and Soc, and we said, hey, this is our list of contents, our concepts, and our topics and subtopics. Where in your textbook is this covered? So the publishers replied to us and filled out a form, and we have put all of it into one form. So on the left-hand side in the red column is the foundational concept that we're talking about, and then the blue is the content category, and under that is the topic and subtopic. And then next are the textbooks, and we've color-coded them so you can see which ones cover it and which ones don't. I want to point out that a number of these textbooks are open source, so we have website links directly to where it can be found, and since they're open source, these are free for you to access. So this is one resource you can take a look at about where the topics and information is covered in these textbooks. So those are some of the free resources we have available. I want to talk about some of the low-cost things that we have available now. We have the official guide to the MCAT exam, 4th edition. It's a print product. It's $30. This includes everything you need to know. It also includes all that stuff that's on the interactive content outline as well. It also has 120 questions, 30 per section. These are sample questions that give you answers and explanations for why the correct answer is correct and why the incorrect answer is incorrect. It also tells you which of the skills is associated with the questions you'll see. So this is $30, and if you receive fee assistance benefits, you will receive this free. There's also an online, you can take the questions in the book online. It's $10. You'll get those free if you receive the fee assistance award benefits. Those are, and if you buy the book and the online questions together, it's $35. We do have a sample test. It's a full-length sample test. It has the same number of questions that you would see on the exam, and it will give you percentage correct. You can take the test timed so that you simulate the actual exam, or you can take it and just answer questions, and as you go along, look at the answers. Again, it will give you response percentage correct, number correct. The only thing this doesn't do is give you an estimated score, because the old practice tests for the old exam were all retired questions from previous exams. And since we have not administered this new test yet, we don't have any retired questions, so we can't tell you how people who actually took the exam did with those questions compared to how you answered. So this sample test will not give you an estimated score at this time. This product is $25 and it is free if you get the Fee Assistance Award benefits. If you're interested in either a Nook or Kindle version of the print book, it is offered through Amazon.com or Barnes & Noble, and you can go there directly to get the ebook version of these things. We also published back in February official MCAT question packs. So there are a total of 6 question packs with 120 questions per pack, and we have 2 in biology and 2 in the critical analysis and reasoning skills, and 1 in chemistry and 1 in physics. If you receive Fee Assistance Award benefits, you'll get 4 of these. So 1 biology, 1 critical analysis and reasoning, 1 chemistry, 1 physics. They are $15 per pack. These are questions from the previous preparing products that we had available, those practice tests. So if some of you had purchased one of those, they might seem similar to you. What we did is we pulled only those that had content that was relevant to the new exam. And what we've done is we've mapped it to the new foundational concept on the new exam to show you how it relates on the new exam. But again, this is something that if you receive Fee Assistance Award benefits, you would get free, but note that these question packs, they might seem familiar to you if you had purchased an old practice test. And coming this fall, we'll have our first official practice test that will again give you the estimated score. So just so you know, beginning next week, we will start retiring questions right away from exams and adding newer questions in. And that's how we will begin building this first full-length practice test. It will have 230 questions, and again, it will come from those previously administered questions. So we'll again be able to offer the scaled score information. This will again be a low-cost resource. I think our old practice tests were about $35. I imagine the price will be similar to that. And this will also be given free to people who get Fee Assistance Program benefits. So you'll receive this. This will not be coming out until after the exam year is done for 2015. Our question writers on our questions and our practice materials, the questions are written by the same people who are writing the exam. So they've been pulling a lot of double duty, and we're trying to get the products out as quickly as possible, but it does take us a little bit of time since we had 25 years with the last exam and we were able to have about 10 practice tests available, and we just don't have the depth yet of the material, but we hope to get there and release products as soon as we are able to for you so that you can prep. I will say too that our products mimic the look of the new exam, what you're going to see online when you go in and take the test. So, and the questions are all written by the people who are writing the questions for the actual exam. So a couple of final thoughts. We're still in a period of transition. There is a lot going on here at the national office. So we are less than 2 weeks away from the launch of this exam, so it's pretty crazy. But we are committed to providing support to students and to your advisors, very important to us, which is why we do things like this webinar. And ultimately, what we're looking to do is provide a better test for tomorrow's doctors. And so we want to hear from you if you have questions or concerns. We're happy to answer questions that you may have, and we might not have the answer right away, but we'll do our best to get back to you as soon as we can. So we just ask for your patience as we go through this and try and get this launch happening and get going with this new exam. And I just wanted to mention a couple of other pre-med resources that we offer. We have the Aspiring Doc site that has a blog on it, and there's information, fact sheets about medical school. It's all free information. We have the Summer Medical and Dental Education Program that's in cooperation with Robert Wood Johnson Foundation. It's for first and second year undergrad students who have an interest, and it does cater to minority students. But if you have an interest in that, it's a summer program that I would encourage you to take a look at. We offer the medical school admission requirements, or the MSAR as we like to call it. It's an online subscription product. Again, you get this free if you receive the Fee Assistance Award benefits. And basically it's a comparison shop of all the medical schools out there. Every year we go out with a survey and they come back to us and tell us what the requirements are, what their prereqs are, student to teacher class size ratio, what their MCAT score minimum is, what their GPAs are looking for, what the mission of the school is. So you can do a little comparison shopping. So that's certainly offered. If you don't receive fee assistance benefits, I want to say it's $23 for a year subscription to the online service. I mentioned the fee assistance program and of course the MCAT. And then there's the medical college application system, or AMCAS as we call it. That's the application that most U.S. medical schools use. There are some schools in Texas that use a Texas-based system. Not all the schools in Texas use it, but they have information on their website about which schools they are. And even though you take the MCAT, even if you're interested in one of those schools in Texas, you can still submit your MCAT scores to them. There's a way to send that group your MCAT scores. And lastly, we have what we call FIRST, Financial Information, Resources, Services, and Tools. Again, we love our acronyms. There's a lot of information in here about loans, debt repayment, loan forgiveness programs. There's a MedLoans calculator that kind of helps you figure out what you're going to borrow and what your payback will be. So those are all resources that are available. And once you become a medical student, there's a MedLoan calculator, or version of it, where you can save all the information that you input into it and update it periodically. So all of those resources can be found on our student hub, aamc.org/students. You can find links to all of that on our hub. Also, if you want to contact us, again, the website is the best place for information, but we do respond to email. We have an email that comes directly to our group. We also have a contact center if you have questions or concerns. You can follow us on Twitter. We have an MCAT specific account. We have a pre-med account, and also we're on Facebook as well, where we post notices and updates and all kinds of information. So you can always get in touch with us. I will say that we're most responsive Monday through Friday from 9 a.m. to 5 p.m. Eastern time, because we are not a 24/7 operation, but we will do the best to get back to you if you have questions or concerns. So that was a lot of information, and I know I go over it quickly because a lot of times people just want to ask questions. So I'm going to open the floor to you folks in case you have any questions.
Thanks, Becky. This is Amber here. Charlie had to run out, so we're going to go ahead and have the students ask you questions now.
Okay.
Who would like to start? Yes, Sam. Did the mic pick that up, Becky?
No, it was muffled.
Okay, he asked, are the old MCAT books obsolete, or can students still use old MCAT prep material?
You know, as far as AAMC products, all of our practice tests went offline, so you can't access them anymore. And when it comes to old MCAT books that AAMC provided, you can use them. Unfortunately, it's not going to give you a good flavor for the new style of the MCAT questions, where you see the content plus the skill you need. So I would just say, if you're looking at it for a content review, if you like, oh, I want to review biology just to review the content, then okay. But if you're looking for MCAT style questions and things like that, I would say no, that those products are obsolete. The AAMC products, I cannot speak for commercial test prep companies.
Thank you.
There are a number of apps. Are there any in particular that you suggest using?
When you say apps, what do you mean?
Like apps for tablets, iPhones.
In terms of MCAT prep material?
Yeah, MCAT prep stuff.
Okay, so we don't have an app. The AAMC doesn't have an app, although great idea. And I think we can't speak to commercial test prep products because, as the administrator of the exam, we don't endorse anyone, nor do we work with any of the commercial test prep providers. So I can't speak to it. I would say to you, maybe visit studentdoctor.net and go to a forum and ask a question, or talk to your peers who have used some of the apps to see what they would recommend. Maybe your advisor has some, has a suggestion for you, but AAMC doesn't have an app, and we just aren't familiar with the commercial test prep developers, any apps they may have out there.
Yeah, I just wanted to know what the best way to estimate your score is as far as, you said that there wasn't really anything that had, your score at this point, but, ideally, I would like to go in and kind of have an idea of what I'm going to get. So what would be the best way to do that at this point?
Okay, so as far as a numeric score, is that what you mean?
Yeah.
So I want you to understand, you're in the same boat as the admissions folks. So they have no idea what the new numeric scores are going to mean either. So what we are talking with as far as admissions folks are, we're asking them to look at those percentile ranks that I talked about and look at those. Because for years we have given schools the percentile ranks of what a 30 means, what percent that is, where the student falls. So let's say that a 30 has been a 75% for years. So that's what it is. So what we're asking medical school admissions folks to do is when the first scores come out, they'll see a number, but take a look at that percentile rank. And if 30 was their cutoff and that was the 75th percentile, we're asking them when they see the MCAT scores to take a look at what number falls into the 75th percentile, but expand that out a little bit in this first year or two, because, we're trying to give a little bit of leeway there. So again, we won't know that you'll get the numeric score for April test about 60 days after you take it and 45 days if you take it in May. But the numeric scores are not going to have as much meaning at first. And so we're talking to admissions officers about using that percentile rank. And those ranges are actually available on our website. We have that data on our website. And I believe advisors have access to that data as well, and they can tell you, what a 30, what percentile rank that has been in the past. So we actually have a professional development conference with admissions officers in June this year before they get the scores, and we'll be going over how to use those percentile ranks to give meaning to the scores. And eventually the numeric scores will gain meaning over time, but right now we just don't have an idea of what their meaning is.
For the different sections of the test, is the increase in time geared towards more the increase in questions, or to give students more cushion time to answer these questions?
Did that Mike pick that up?
Okay, so what I heard is the more time per section to give students more time to answer the questions. Is that correct?
Correct. Yeah. Or is it because there are more questions?
Well, there are more questions per section, but actually compared to the old exam, if you put, how many minutes and seconds you had or how many seconds you had per question, there's more time per question on this exam. Even though there are more questions, there's more time per question than you would have had on the old exam. And that's to give you a little bit more time, realizing that because now you're not just being asked about your knowledge, you're being asked to apply that knowledge, whether it's looking at a chart, a table, a graph, and then answering the question based on the data that you see and interpret in that visual, giving you a little bit more time to do that. So that's why additional time has been added.
Any final questions, guys?
If you've never taken an intro psychosocial class, how would you suggest studying for that section?
I heard the first part, if you haven't taken a psych or soc course, but I didn't hear the rest.
What's the best way to prep for that section if you haven't taken the coursework?
If you haven't taken it. So I would say go and use that resource that shows, that has the textbooks. And again, almost all of those are open access. So it'll tell you exactly based on the topic and the content category where in their book it's covered. And on that spreadsheet, a lot of them are direct links to the page where it's covered. So I would say use that. I would also say check out the Khan Academy videos, because the psych and soc section was the first section they worked on, because we knew we didn't have any prep materials with any of that in it. And so that's what they have worked on, and that section of their videos was built up first. So I would say use those two free resources first.
Any final questions?
Could you just quickly reiterate where we would find that spreadsheet? Is it just online?
Yeah, it's on our website under the AAMC.org/MCAT, and there's on the sections, I think there's preparing, that's a section, and you just click on that, and that has all of our resources, whether it's a free resource or one that costs up to $30. So go to the prepare. If you go to aamc.org/MCAT and then click on the link on the left side for preparing, that'll take you to all of those resources.
Okay, I think that's all of the questions that we had, and a lot of students had a class at 5, so that's why I have some students leaving.
That's okay.
Oh, final questions? Okay, well, thank you so much for your time, Becky.
Thanks.